Beth Hibbard is undergoing one of 6 chemotherapy sessions at the WLUK Center for Integrative Therapy in Illinois. Every 3 weeks, she's here for her day-long treatment.
Okay, I got more pre-meds coming up soon.
Hibbard's husband took this video on a recent visit. The De Pere woman was diagnosed with breast cancer in June. She is a wife and mother of 3.
I still to this day have a difficult time saying I have cancer. Those 3 words are very difficult to kind of wrap your head around and understand.
Beth says she chose the WLUK Center because it offers more than medical treatment. The WLUK Center also focuses on nutrition and wellness. Done in just 6 sessions, the treatment is more intensive than traditional chemotherapy. The drugs attack any cancer cells that may still remain in Beth's body.
It goes through your bloodstream, and because I had it in my lymph nodes, they don't know for sure if it has gone further into the bloodstream.
The chemotherapy has taken a physical toll on Beth.
I've lost my hair. I have just the typical reactions from the chemo. I have some nausea, not a whole lot. I get very tired. I lose my stamina, my energy.
Even while dealing with those negative side effects, Beth remains optimistic.
I think that I'm rebounding back much more each time I have the chemotherapy because of the activities that I'm doing, trying to stay healthy, and the food that I'm eating, and just kind of the holistic approach that I'm taking. The chemotherapy is actually going quite well.
Beth was surprised to learn she had cancer last summer.
I had no signs of it. I'm a very healthy person. I'm a runner. I used to teach swim lessons at the Y. I still like swimming. Very active with my kids.
This isn't just the story of one woman's cancer. It's a real-life tale of how no one is ever alone. You see, Beth may never have realized her diagnosis if not for her friend and colleague, Sarah Hersher. Beth and Sarah, both 43 years old, are sharing a journey through the disease.
On Friday, March 13th, found out that I did have breast cancer.
Sarah found lumps in her breast last December, but she was used to feeling lumps as she had a history of fibroadenomas, or benign lumps.
I had 2, actually, and these didn't really feel any different from the other ones, actually. But and I'd been getting mammograms since I was like 35 years old. But the mammograms didn't show it.
Sarah and Beth shared a history of non-cancerous lumps, and the 2 friends shared another trait, dense breast tissue, which breast experts say can make it harder to see cancer when viewing a mammogram. Sarah's doctor detected her cancer with an ultrasound. She immediately called Beth.
I can remember talking with her about it last year, just because I think we'd both had lumps in the past checked and things like that.
Beth asked for a breast MRI. Her doctor said it would be expensive and insurance might not cover it, but Beth wanted peace of mind.
I was not in any pain. I don't have a family history besides, my mother just being diagnosed at an older age last year. None of the genetic history. There was really no reason to look at that MRI.
A couple of days later, Beth received the shocking news.
Some of the lumps on the MRI showed some concern, so they wanted to do biopsies. And so they did a couple biopsies, and those came back cancer positive.
It demonstrated that there basically was, one area of cancer in that right breast, in spite of the fact that she'd had in the past multiple other benign tumors, specifically the fibroadenomas in that right breast.
Beth's doctor, Dr. Alonzo Walker, says her lymph nodes, which help the body fight against things like infection, also had cancer. 15 of 21 removed tested positive.
With the reported pathological size of her cancer, this is one thing that we did not expect and don't usually find.
Once Hibbard is through with her cancer treatment, Dr. Walker says she will officially be cancer-free. However, he says her future remains uncertain.
One would say that she is at high risk of recurrence of her cancer. We're not as concerned about the recurrence in the breast, but more distant cancer.
Dr. Walker says that's because Beth had so many lymph nodes that tested positive for cancer cells. He says that increases the chances cancer can spread to bones, lungs, liver, and sometimes the brain.
She will have to be followed very closely and carefully.
Beth says the extensive lymph node removal is already having other effects.
Kind of long-lasting repercussions. I still cannot feel part of my upper arm. I'm going to physical therapy right now to move my arm.
Beth says lymphedema or swelling is another concern, as is the possibility of infection.
I have to be very careful with my right arm. I cannot have any shots. I cannot have any blood drawn. Can't have my blood pressure taken. I can no longer get a manicure on that side.
The American Cancer Society says a mammogram can detect about 80 to 90% of breast cancers in women who have no symptoms of the disease. So who needs extra testing?
For women who are at high risk, so who have that personal history of breast cancer or have a history of breast cancer in their family, who may be susceptible to genetic risk for the disease, should be receiving an MRI.
American Cancer Society spokesperson Lori Pagel says if you have any other concerns, be sure to discuss them with your doctor. The American Cancer Society recommends additional testing, whether it's an MRI or a breast ultrasound, should always be done in conjunction with the mammogram.
I can't thank her enough.
Beth and Sarah now share a bond that will never be broken.
You know, yeah, how do you thank somebody for saving your life?
And they lean on each other.
It's nice because just especially the down days, it's really nice, you know, when you're bald and have no hair, no eyelashes, but yet you're happy to be here.
Sarah had both breasts removed and has just finished her radiation as Beth continues her chemotherapy. Both are optimistic for a total recovery. This sisterhood forged out of a disease doesn't stop with Beth and Sarah. Now they've come forward to protect other women, urging them to take that extra step to join their fight against cancer.
I want people who have been in my spot and Sarah's spot and a lot of other women's condition where they may have these fibroadenomas, please go in and talk to your doctor and just say, can we go one extra step? Can we go to an ultrasound? Can we go to an MRI just to be sure? Even if you end up fighting with the insurance company or paying for part of it yourself, it's your life and it's worth it.
Beth Hibbard's last chemotherapy treatment is on December 23rd. Starting in January, she will undergo 6 weeks of radiation in Green Bay. It's an extra dose of therapy to ensure Beth remains healthy. Laura Smith, Fox 11 News.